Hi, I'm Sally Lehman, and I'm with The Advocate. Today, I'm sitting down with Dr. Adam Brady, who works in infectious diseases at Samaritan Health Services in Corvallis, Oregon. Hello, Dr. Brady, and thank you for being here.
Thank you for having me.
So, you received your undergraduate degree at Oregon State University. Are you originally from Oregon?
I am, yeah. I grew up in I grew up in Lake Oswego. Went to Lake Oswego High School and then went to OSU for my undergrad education.
Great. And how long have you been at Samaritan Health Services?
I've been at Samaritan for nearly 5 years now. So I finished my training in infectious disease in 2016 up at OHSU and came straight here afterwards.
Obviously, the subject that is on everyone's mind is COVID-19. So, can you give us an idea of how this disease spread from one province in China to everywhere in the world?
This infection has been obviously a lot more tricky than other viruses that we've had to deal with. And, I think one of the game changers, and there are a couple of them, sort of the stars have to align, or you have to tick a whole lot of boxes for a virus to be able to spread rapidly across the world. One is it has to be very well transmitted between people, which obviously this one is as well. But there are other coronaviruses like SARS-1 and MERS that sort of burn themselves out because they cause a whole lot of symptoms and they cause people to get sick. That one of the game changers with COVID-19 is that it caused a whole lot of people to have asymptomatic infection also. So whereas with the flu and other viruses, you're usually not contagious for very long before you have symptoms, if you are at all. This one, we had lots of healthy feeling people walking around. And if you're healthy, you can spread the virus, which makes it very difficult to isolate people and have people stay home if they're feeling well.
So, what was it like at Samaritan when things first began to lock down?
Yeah, it was interesting. We were sort of, flying by the seat of our pants somewhat. It's a brand new virus. I remember, we had meetings as early as January of 2020. Before everything locked down, we were keeping our eye on the situation in China and elsewhere. And then when cases started to come into the United States, we felt like we were somewhat ready to handle it, but it's been a big learning experience. As things change, recommendations change, and staying on top of the most updated information has been paramount this entire time. So I feel like at Samaritan we were very proactive with how we have dealt with COVID-19. We stopped elective surgeries before it was mandated by the governor and sort of cut back. This is way back in March of 2020. So being real proactive, and I think it's served us well throughout the pandemic.
A lot of hospitals across the country, across the world, were running low on supplies very early in the lockdown. Did that happen at Samaritan?
The supply chains were disrupted, for us, just like they were for everyone. And we had a lot of difficulties with testing supply. So the testing, the media, the liquid that the test swabs go in, the swabs themselves, those were hard to come by. We got creative, partnering with OSU to have them create some of this media for us. And then with PPE as well. So, I'm sort of proud of our materials management team. They never ran out of PPE. They were very creative with sourcing masks from different vendors. And, we had to do some rationing of personal protective equipment, but it was never to the stage where we weren't able to provide safe protection for our staff.
That's very impressive. How did the TRACE program at OSU feed into that? Did they help? Did it hinder?
Yeah, so the TRACE program, or at least, this, when we were talking about partnering with OSU, this was before the TRACE program was really up and running. We were working with the veterinary lab at OSU to get the reagents that we needed for the testing supplies, which was a really nice partnership. The TRACE project has been very complimentary. It gives us information about what's going on in the community, about transmission rates, especially with people who aren't sick. So that's been helpful information, but it's not as directly involved in sort of the clinical portion of COVID-19.
We're going to stick with OSU, which is one of the researchers there contributed to a new ventilation or ventilator system to use with patients. Does Samaritan have anything to do with the testing of that, or did you have any recommendations for them or a way for you to be able to use those new ventilators?
I have not personally been involved in those discussions. I do know early on there was discussions with OSU about different pieces of ventilators and seeing if we could use 3D printing to come up with uh, items that might have been in short supply. But with any sort of new medical device like a different type of ventilator, it has to go through lots of regulatory processes before it can actually be used. So myself, at least I can't speak for everyone at Samaritan. I have not been involved intimately with that particular project, but I'm excited to see that work is happening locally. Here at Samaritan, we were never short on ventilators. We actually were able to obtain more ventilators than we would have actually ended up ever needing through loans and leases and things like that. But as the pandemic, wore on and we knew more about how to treat COVID-19, the reliance on ventilators has gone down, thankfully. So less people end up needing ventilators, whereas back in March of 2020, lots of people were becoming ventilated from COVID-19. So advances in treatment of COVID-19 made that made ventilators less of a need, thankfully.
How many COVID patients have you had at Samaritan Health Services?
We've had our fair share. It goes up and down depending on the levels of cases. We had the most at any one time was over the winter time in January, where across our 5 hospital system in Corvallis, Albany, Lebanon, Lincoln City, and Newport, we had between 20 and 30 patients admitted at any one time. It's creeping up to that level again. I think in Corvallis this morning, at least, we had 9 patients that were hospitalized, and it's trending upwards again as cases are continuing to go up. So we're trying to make sure that we're focusing lots on our vaccine effort to prevent that from happening, but are ready for another surge in patients like we're starting to see.
Samaritan Health Services is helping with the vaccination effort over at Reser Stadium. That seems to be going very well from everything I've heard. How do you feel about the process there, about people getting in a timely manner and being able to get their vaccines?
I've been really proud of the effort. I actually just came from there now, just to see what was going on, and it's been a very smooth process. I've heard very good feedback from community members that have gone through that site. Samaritan has taken a pretty big role, if not a lead role, in getting that off the ground with excellent support and help from Benton County and Oregon State. But I think that's something that Samaritan should be proud of, and the region should be proud of. They're able to do thousands of vaccines per day with very minimal wait times. It's a very friendly environment. Everyone's happy to be there. I know it is a barrier to some to get to a large vaccine site like that. So while we are running the Research Stadium site, we also have smaller clinics out on the coast in Lincoln County and mobile sites that we're working on around the region as well.
What have we learned about when we look at the response to this outbreak and surveilling for new viruses like this?
I think we've learned a whole lot. Again, and I hope sort of we as a society have learned a whole lot as well. There's lessons good and bad that were learned. I think and some people will take this with different ways, but as you can recall, early in the pandemic, it wasn't really recommended that masks were used by the general public because we didn't know if this virus was transmitted very well from your hands, and could you contaminate yourself by touching a mask all of the time? And don't typically do that for other viruses. And so, but as we learned more about how this virus is spread and how well masks worked, and it didn't seem that surfaces transmitted COVID-19 very well, we were able to pivot and fully recommend that. So I think one of the lessons learned is that we have to be flexible and not sort of hold on to preconceived notions of things, because with a new virus, you have to, or with a new infection or an emergency like this, you have to act fast. And if you don't, then you're going to be behind. And so you can't always be right on the first go. You have to go with the best available evidence in order to try to get ahead of something like this.
When do you anticipate the next big virus coming along?
There's always something, whether it be H1N1 flu or Zika virus or Ebola virus. Again, we're monitoring cases of Ebola that are going on in Africa at the moment. So, it's hard to predict these things, but in the world we live in today, when there's, so much interface between nature and, large cities and lots of travel around the world, these things can happen. And, it seems though that to have a virus of the magnitude of COVID-19 that's so well transmitted and well suited to replicate in humans, it seems to be, and I'm going to say hopefully when I say this, a once in a maybe 100-year event, with the last time that happened with the Spanish flu of 1918. So again, I'm hopeful this is the only pandemic of our lifetimes, but again, science is hard to predict sometimes.
That's true. We can't always hope that it is the only one in our lifetime, though. Yes.
I hope so. If it does happen again, I do hope that we learn lessons as a society, and and we fund our public health partners better than we have in the past, and we'll be ready. So I hope we do learn our lessons once we come out on the other side of COVID-19, and we are more prepared for whatever may come next.
For people who have been really cautious and careful and staying at home and wearing masks, what are you seeing in terms of pandemic burnout?
I experience it every day. Our staff in the hospital have experienced it. So it's, this is exhausting. As I mentioned, this has been going on for over a year now. And, you keep thinking it's going to be over and you're going to move on. And then you look back and it's been over an entire year. So to people who are feeling burned out, I totally get that. And I understand completely. But this is also the most hope that we've ever had in the pandemic. We have vaccines that are rolling out, and nearly half of people eligible have gotten a dose of vaccine in many parts of the country and in our region as well. So I think that there is a light at the end of the tunnel, and the more people that become vaccinated, and the safer that we are, and the more careful that we are until more people become vaccinated, we're going to come out of this on the other side, because we still have a little ways to go.
So how is Benton County doing compared to other counties or states as far as vaccination goes?
Benton County is doing very well with vaccination rates. The last time I looked, which was earlier, probably from yesterday's data, Benton County residents were only second to Lincoln County residents in the proportion of people vaccinated, the percentage of residents vaccinated. So really, exceeding the levels of exceeding the state average in every age group from 16 and up. So really looking positive in Benton County as far as the number of people becoming vaccinated so far, which is very, very encouraging.
How is Oregon doing compared to the other states?
Yeah, in terms of vaccine rates, I would say it's sort of middle of the pack. It's not at the top and it's not at the bottom. So it's, probably a little bit, less, it's less than 50% so far, but that's climbing every day as well. Oregon has really been spared the brunt of the pandemic as far as cases are concerned. But with the arrival of variants and, because we've been spared lots of cases, not a whole lot of people have natural immunity or have caught COVID-19 by itself. So we're especially reliant on people becoming vaccinated so that they are not infected. And as we see cases rising, Oregon has one of the highest rates of increase of COVID-19 cases now, actually in the United States. Even though cases are overall low, they're increasing at a rate that's fairly concerning. So another reason that it's very important to consider getting vaccinated, because they're so effective at keeping you out of the hospital if you do get exposed or infected with COVID-19.
What would be your advice for someone who wants to travel at this time?
It's a very individual decision. I think it depends on where you're going, what your plans are to do. If you are unvaccinated, I'll be very worried about going and traveling at the moment, especially in an airplane or being around a whole lot of people, just because of cases, and cases that are spreading all over the United States. If you're vaccinated, the CDC has brought out more guidance to say that, you probably don't need to quarantine after you come back. You probably don't need to test before or after you come back, and that travel is generally safe once you're vaccinated. So I think the general message is once you're vaccinated, and having been vaccinated myself, I feel this, that, a lot of the concern for your personal health and safety from COVID-19 is a whole lot less once you're fully vaccinated. So as long as you're not avoiding very risky scenarios like, large indoor concerts or places where you may come in contact with lots of people who are potentially unvaccinated, travel in general is considered safe. But again, it depends if you have an elderly person at home who's unvaccinated, travel may not be wise, so it depends on your personal situation. But in general terms, being vaccinated greatly decreases your risk of travel.
how often should the average person be cleaning or washing their cloth facial masks?
Probably more than everybody is, is an answer. Um, the just sanitation reasons, it's nice to wash it. Depending on how often you're wearing it too. If you're wearing it just for 10 minutes a day, going into the grocery store, you might not need to wear it as much as if you're going to work and wearing it for an 8-hour shift in a row, right? So, I think just I would almost consider it like an article of clothing that you normally wear. You probably wouldn't want to wear the same T-shirt, for 3 weeks in a row. Try to just keep a regular rotation of masks and keep them clean. Again, like I mentioned before, the concern with touching contaminated objects and then infecting yourself with COVID-19, that seems to be an extremely unlikely thing to happen. But it depends. If you're around lots of people all day, you probably want to wash that mask every day. So I have been usually wearing the disposable masks, and I will reuse them. But if I'm in an environment that I'm around a whole lot of people, then I'm probably not going to use that mask again. So I think it depends on your level of activity, but I wouldn't forget to wash it regularly in general.
Anything else that you want people to know about COVID-19?
I'm very worried right now for people who are unvaccinated, and because we are seeing increasing levels of hospitalizations not only throughout Oregon but in the Samaritan system, and invariably, almost everyone, pretty much everyone, to be honest, that is hospitalized has not been vaccinated yet. Okay, so I can tell you that if you are able to obtain a vaccine, and now everyone in the state of Oregon is eligible to get a vaccine, and there are appointments out there. I would strongly encourage you to get vaccinated for COVID-19 because it will effectively keep you out of the hospital. And this month we've seen more people between the ages of 40 and 59 years old be hospitalized as well that are unvaccinated. So again, I strongly recommend considering vaccination. It's safe. Over 91% of the doctors and clinicians at Samaritan have chosen to become vaccinated as well. So I think it's something that if you have the ability to get, it will protect you and those around you. If you go to samhealth.org/get the vaccine, all one word, information in Lynn, Benton, and Lincoln counties on how to get signed up for a vaccine. So we can get vaccinated, the better off we're going to be.